Who let the dogs out? 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 While the party was nice, the party was pumping.
How would you define animal-assisted therapy?
Animal-assisted therapy to me is used as it's another tool in the toolbox, as I like to say. You know, in therapy, there's various techniques that you can use to facilitate patients' functioning, whether it be motor functioning or cognitive functioning or language functioning. And having an animal, as Puma here, can really help facilitate achieving goals in any of those areas. So that's largely how I see the animal-assisted therapy. Again, they don't have to participate in an entire treatment session, nor every treatment session, but depending on a patient's goals, you can really kind of tailor their treatment plan and utilize the dog appropriately to motivate or to encourage movement or to encourage speech or work on memory skills to recall the dog's name or facts that you give the patient about the animal. So all of those things can be utilized.
Okay. How do you get certified specifically, and who can get certified in animal-assisted therapy?
This organization, it's called Canine Companions for Independence, and they're based out in, their breeding program is out in California. The animals are bred there, and then at about 6 to 8 weeks of age, they go to puppy raisers all around the country. And they're with those individuals or families, or even some in prisons. They work with prison programs around the country. And they're with those individuals for about a year and a half. At about a year and a half, they then are brought to one of the regional centers. I believe there's about 6 in the country. And then the animals go through 6 months of advanced training there. After all of that, and if they still meet all the criteria to either be a service dog to someone with a disability or a facility dog, which is like what Puma is, where he has an able-bodied handler who comes into a facility of some kind. It could be a school, a hospital, a nursing home. Then there's 2 weeks of training for that handler at one of the regional centers. So I went to Orlando, Florida for the 2 weeks to learn how to work with him and for him to learn how to work with me. And we worked on basic commands, as well as just dog behavior, how to train new skills, how to practice the skills he had already been taught, and how I could be a better handler for him.
Okay. Question: what populations have you worked with, and in what settings?
With Puma specifically?
Yes, with Puma.
With Puma, I've worked on the brain injury unit here at Methodist, the stroke unit here at Methodist, and with patients with spinal cord injuries and orthopedic injuries. Here at Methodist, we largely treat patients age 13 to 100 or even higher. And so it's largely been more of the adolescent to adult population.
Okay.
Here at Methodist, but across all diagnoses, really.
Right. Okay. And how do you decide that a patient needs animal-assisted therapy? And do you use it with all of your patients or just specific ones?
Well, it is interesting. When I was on the brain injury unit, each therapist generally has their own caseload. So I would decide for myself whether any of my patients specifically would benefit from the animal-assisted therapy. And then I kind of relied on other therapists to come to me if they wanted Puma to work with their patients as well.
Right.
And now that I'm not directly on any one of the floors and I'm more in the research department, I rely on therapists largely to call me or text me and say, oh, I have a patient that I think would really love to see Puma. Would you mind coming up? Or even physicians have stopped me in the hallway. And then when I do have time, I will just come up and walk around the gym when there's a lot of patients in here and kind of just go by, oh, can you come over here? Can you come over here? Or if some patients are doing this, then I stay away. Because unfortunately, there are some people who are afraid of dogs, and even though he is very, very mild-mannered and does not jump nor bark or anything of the sort, he is large, and so, you know, some people just have a fear of dogs or allergies, you know, so I will stay away from.
Okay. Well, thank you very much
Okay,
for all
you're
of your
welcome.
information today.
And everybody having a ball.
Hi everyone, I'm Jen Sivak, an OT here, and this is my patient Jessica, and we're gonna engage in a treatment session here. Jessica has a few little balance issues and some weakness on her right side, and we're working on our standing endurance as well. So we're gonna turn and face the mat and pull a stay. And I'm gonna have you try to grab this sheet with both hands. I know your right hand's a little bit weak, but we're gonna work on it together. We're gonna try to spread this sheet out here on the mat as best we can. So we're gonna get Puma up here. So as you can see, we're trying to engage bilateral arms in this task as well. And it can also help people with at-home activities too, in terms of folding or making a bed. Here, let's move this right hand up to here.
The starting in calling. And the girls respond to the call. I hear a woman shout out. Who let the dogs out? Who let the dogs out?
Okay, well, perfect. I brought a little brush here, and this is gonna make it easier for you to hold it, where you don't have to maintain your grasp the whole time, and you can just give him a little bit of some brushing. So we're gonna slide here.
Who let the dogs out? Who let the dogs out? I see the dance people had a ball cause Billy Fountains get out. Get back, Gruffy, bash Gruffy, get back, you flea infested mongrel.
All the way over here towards his head. There you go. Good. So we're getting a little bit of sometimes some weight shift in as well when someone's standing. And you can go from his head all the way down. There you go. Good.
Skin mongrel. You ain't nothing but a hound dog.
I'm Jessica, and I'm an occupational therapist, and I'm here with my patient Kayla. I'm at her home for a home health visit, and this is my therapy dog Valley, and we're going to engage in a treatment session. Okay, first we're going to do a game of fetch, and this is going to work on grasping the toy, as well as upper extremity strengthening and range of motion. So I'm going to give the toy to my patient, and she's going to throw it in the box. Valley, Valley, you ready? Get it. Yes. Okay. Okay, so our next treatment activity, we're gonna walk the dog, and this is gonna work on balance and coordination, as well as mobility and leisure activities. And also, I would apply a gait belt.
You ain't nothing but a hound.
Okay, so next treatment activity, we're going to work on IDLs, specifically care of pets, and the first thing we're going to do is work on feeding. So she's going to go ahead and put the food in the bowl, and when you're working with your patient, make sure that they're using proper body movement, bending with their legs instead of bending with their back. Put the food in the bowl.
Crying all the time. Well, you ain't never caught a rabbit and you ain't no friend of mine. Well, they said you was high class.
Here we are in the bathroom for another IDL activity, group bathing Valley, and this is going to work on bilateral coordination, crossing midline, reaching, and things like that.
Was just a lie.
To summarize our treatment session, we're going to talk about some different ways to grade each activity that we did. So for the game of fetch, you could grade that by adding wrist weights to the patient's wrists, or doing the activity with a weighted ball to help it be harder for the patient. I was working on strengthening. Also, for the walking the dog activity, you can grade that by having the patient walk longer distances for endurance. Also, walking on different surfaces, walking uphill or downhill. And for the feeding, you can grade that by having the bowls on a higher surface to keep the patient from bending down.
Yeah, they said you was high class. Well, that was just a lie. Yeah, you ain't never caught a rabbit and you ain't no friend of mine.
Sorry, Sorry, I didn't know you had started. All right, is it on now?
Yeah.
So first we're gonna do a game of catch. Good girl.